I would like to welcome you all again to this insightful faculty development program exploring academic research, overcoming challenges, and embracing opportunities. Heading towards the second keynote of 6 day, let us remember that faculty development program are not just about exchanging idea, they are about fostering connection, building bridge, and catalyzing the changes. I'm thrilled to extend a warm welcome to everyone joining us for this afternoon session on interdisciplinary collaborative research for professional academic development in higher education. Today, we are honored to have Dr. Lata Venkatesan, a renowned expert in this field, share her insight and experience with us. Dr. Lata completed her PhD in nursing and human development and family studies and MBA in hospital administration. She has total experience of more than 30 years in teaching and clinical experiences in premier national and the international institution. She has organized many national and international conferences. She is also a core member of NABH. Welcome you, ma'am. Yeah, your expertise and dedication to advancing the interdisciplinary collaboration in higher education will undoubtedly provide us with valuable perspective and practical approach to enhance our professional academic development. Please join me in giving a warm welcome to Dr. Lata. Over to you, ma'am.
Yeah, thank you, Gagan, for that kind introduction. And at the outset, I congratulate Chitkara University for regularly organizing faculty development programs, that too with very novel, thought-provoking topics which has been selected.
Yes, ma'am.
Yeah. So today I'm given the topic to talk about interdisciplinary collaborative research for academic development in higher education. Just a minute. So, nursing is one of the largest healthcare profession, but at the same time, we need to work with uh, a team of professionals who are from other disciplines. So we need to collaborate with them so that we will be able to come out with better products and better processes as well. So that is what we are going to discuss in this session today. So why we need interdisciplinary research? It is essential for addressing the complex health issues and improving patient outcomes. One example I would tell that earlier we were going at the bedside and checking the vital signs of the patients. But now that you have got the technology which has come in place, where in the nurses station we can get the vital signs with the pop-ups of alert values, whether they are having fever or the vital signs are below normal or above normal, we are able to get it sitting in one place and also through remote monitoring. From various other places also we can get it. So how is it possible? Because of the application of digital technology. So we need to liaison with the people, those who know the technology, but they may not know the domain requirements, or they may not have the domain expertise. So when we give the domain expertise, they will be able to give the technology. So that is how the world is going, especially in the field of healthcare research. Uh, Artificial intelligence is also playing a very vital role. So let us discuss how we can promote this interdisciplinary research. We need to have certain strategies for promoting interdisciplinary collaboration, because suddenly we cannot develop an idea and collaborate. It requires a very structured strategic approach. So in universities, in academic institutions, to promote the interdisciplinary research, what are all the steps can be taken, can be discussed in this forum. First one is, first we need to establish collaborative research teams. You need to identify with whom you are going to collaborate. Are you going to collaborate with the technology experts, or are you going to collaborate with the experts in behavioral sciences such as psychology, sociology, or are you going to collaborate with public health experts? The collaborative approach, how in Haryana has brought good results. This is a typical example that Beti Bachao, Beti Padhao. This was a true example of the collaborative approach where the public health experts, nurses, doctors, and the NGOs has joined together. And in Haryana, over a period of 8 years, they have reversed the female-male ratio from 930 out of 1,000 to 1,003 females for 1,000 men. It was all possible because of the collaborative approach. So first of all, we have to identify with whom are we going to collaborate. Then it is essential to establish collaborative research team. Here we did a study where in palliative care, how to help the patients with medication adherence with the help of artificial intelligence guided mobile app. So you require an expert who develop mobile app. You require someone who is good in artificial intelligence. You require palliative care experts, and you require the patients and then the nurses. So with this team approach, we were able to implement an AI guided mobile app for guiding palliative care. So everybody has to have a shared goal, then it is possible. So the first and foremost step is you have to establish the collaborative research team. And sometimes this collaboration might be regional also, like you want to have some project, multi-country project, then you have to identify the researchers with similar aptitude, similar interest from various other countries. Or if it is a multi-centric trial or a nationwide pan-India trial, then you have to choose your collaborative research teams across India. So this way you will be able to collaborate. And the second step is creating a collaborative environment. Only if we create a team, and if the environment is not there, it is difficult. So you have to identify suitable team and where they are going to implement the research, or where they are going to do the data collection, and the outcomes will be translated into practice. So this should be evaluated. So you have to ensure that the leaders are advocating for interdisciplinary research, and they should have dedicated space. It might be physical space or virtual space where they can work together. So this is how a collaborative environment has to be created. So you create a team and you create a collaborative environment. For example, you want to do some research related to simulation, then across the country which are all the good simulation labs. Then you must get connected with them, and then you can carry out the research. So the environment must be there. Suppose you select a team where they do not have facilities for simulation, whereas your research is related to simulation, then naturally the project will not move on. So you have to create a collaborative environment with feasibility study of adequate space is available either physically or virtually. Then after this, you must look for joint funding opportunities. So interdisciplinary grants are available now. So you have to seek and apply for grants. When you're applying for grants, initially the seed money is given to explore the potential area of research. Then there is a major grant given. So the grants are usually happening in two stages. Otherwise, you can go for a major grant straight away also. Otherwise, you can have a seed money and then you can go for a bigger grant. Usually it happens like that. Here also in AIMS, also intramural funding is given where you, with the intramural funding, you identify a potential area and do a kind of an exploratory research. And with the findings of such research, then you can go for a bigger grant. You can go for a grant from international funding agencies as well. So this is very important. So you have to seek out and apply for the grants. And for this, you have to train the team how to apply for grant, how to write for grant. And it is essential when you're formulating a team, formulate a team with the people who have got experience in funded research or who have already got the grants. At least few people you should have in the team so that they'll be able to guide the entire team. But it is not necessary. But for these are all the some of the tips for um, overcoming the difficulties. But sometimes it may not be possible. Then we have to go for the people who are wanting to go for funding. Then you have to encourage the institutions also to allocate the funds and resources to support interdisciplinary research efforts. Whereas when it comes to nursing, such grants are not available exclusively for nursing, first of all, and interdisciplinary also it is not there. When ICMR, DHR, other people, when they call, also the word nursing is not there, but it comes as MSc, MSc Life Sciences or MSc. So in that we apply. So whereas we also have to look for exclusive research fund allocation for nursing projects. Yeah, I'm proudly would like to mention here that in AIMS, when we wrote that we require um, exclusive funding for nursing research, they have accepted, and yearly 10 projects they said they will support. In rotation, all the faculty will be able to have some or other intramural project which is being supported. So, like that, we have to go for exclusive funding, whether it is for interdisciplinary research or exclusive nursing research. We require funding. So, the institutions must allocate and earmark funding for nursing research so that we need not compete with other professions, and the priority goes for medical projects can be usually it happens, but nursing projects also can be given importance with allocated earmarked funds. And professional development and training also is required. Workshops and seminars have to be conducted. You have to organize workshops and seminars on interdisciplinary research methods. We have to identify which are all the potential other disciplines we can liaison with. Like here in AIMS, we have a project where it is on genetic counseling and genetic illnesses. And they have identified one of our faculty and trained her to be a genetic counselor, and she is running a nurse-led genetic clinic. So, similarly, there are also other areas where the nurses are part of the interdisciplinary project and we contribute. So, we require a lot of training. And we also have another project which is a WHO CRO project with 5 countries. And we did a curriculum analysis, curriculum gap analysis, and we were trained initially how to conduct it and how to meet the objectives of the project. And we did a curriculum evaluation or curriculum gap analysis in non-communicable diseases. And the findings were shared with 5 other countries, and a comparison was done how it is India stands with other countries. So these are all some of the activities which was happening. And based on the findings of the study, some mentorship training programs were conducted, and we also established the modules and contributed to WHO for establishing that modules, which was through a project which was given to our community medicine department, but they also included College of Nursing from AIMS and JIPMER and from other countries also. And then we were able to contribute in that project. So such interdisciplinary projects are also happening. Another example I would tell you that during COVID, the CDAC, which is a subsidiary of Ministry of Electronics, they took online training responsibility of nurses and medical professionals across the country. And more than 1 lakh training people were trained, some were online, some were physical. In that, the medical team and the nursing team were selected, and we were able to contribute with Ministry of Electronics. So initially, I was wondering that, oh, Ministry of Electronics, yeah, we require online support, during COVID, we required online platforms. So Ministry of Electronics pitched in and they liaisoned with Ministry of Health and Family Welfare. And then we were able to develop the courses and implement the courses online. So like this, sometimes you have to have more than one discipline, you have to collaborate. And then utilizing technology. So this is what I was telling, that we had program with CDAC, which is a subsidiary of Ministry of Electronics, and we were able to implement the COVID training. So you require collaborative platforms, that is using digital platforms and tools that facilitate communication data sharing and project management among the team members. We also require data integration, that is implementing systems that allow for the integration and analysis of data from multiple disciplines. One example I can tell you, we have Ayushman Bharat program. In Ayushman Bharat program, everybody is supposed to create an ABA account, that is Ayushman Bharat health account. Now it is becoming every hospital UHID will be linked to ABA account so that we can refer and uh, we can look back our documents wherever we go for treatment across the country or anywhere in the world. We'll be able to retrieve our documents related to our health. So the ABA account has to be created by every citizen. So this awareness has to be spread. So once ABA account is created, it will be linked to UHID, Universal Health ID, where whichever facility you're visiting. Then with your ABA account, you may visit any hospital, you may change the hospital, and you may visit multiple times, or you might have visited rarely, still you'll be able to retrieve your documents. So it will be easy for reference. Then they also have got health professionals registry where the doctors, nurses are expected to register under this. So what is the advantage of this registration is once they register, they'll be able to geographically locate where the doctors and nurses are there. Probably next phase when they have interfacing of primary, secondary, and tertiary care facilities given in a geographical location, they'll be able to work in a coordinated manner. So this is how we have to use multiple platforms, like hospitals are linked to Ayushman Bharat, and Ayushman Bharat links the citizens and the healthcare professionals. So it's a kind of an integrative approach which is coming, and so this also can be used for spreading awareness for better utilization of the healthcare professionals and interfacing the primary, secondary, and tertiary care. And then uh, I would like to say here that when the patient is getting discharged, especially after a surgery or after an oncology treatment, then you want someone to help them to in their own place. Then you can, if you have this GIS tracking of health professionals, then we'll be able to recommend and refer. And one more example I would tell you is now school health. School health, every school is supposed to have a school health nurse. Whereas Ministry of Education is different in our country, Ministry of Health and Welfare is different in our country. So Ministry of Health do not have the data how many school health nurses are there in the country. Ministry of Education do not share their health related requirements with Ministry of Health and Family Welfare. So this kind of interdisciplinary approach, interministerial approach, interfacing the activities of different ministries will be really helpful to utilize our talents and reach out to the population. So now they are working on it. Like Ministry of Education will give the data how many school health nurses are appointed, whether every school is appointed with a school health nurse or not. Then we have to design programs for school health nursing and equip the nurses to work in the school health setting so that they are able to meet the emergencies, monitor the growth and development, educate the parents and children, and from childhood we'll be able to incorporate the habits of health. So like this, the interdisciplinary approach will be highly helpful. And publishing and dissemination, when it comes to publishing and dissemination, when it is an interdisciplinary approach, it requires a kind of common understanding in the beginning only. Otherwise they will say that who is the primary author, who is the secondary author, which profession is big, which profession is less. This kind of arguments might arise. Excuse me, please bear with me. I am not well. So interdisciplinary journals, there are also multiple interdisciplinary journals are coming up that can be used for publishing. But then the authorship, the primary authorship, the secondary authorship, co-authorship, all these details have to be decided at the beginning only, and it must be published in interdisciplinary journals. So when we publish, naturally this will be helpful for others to replicate the study and look at the areas of uh, further collaboration. And I would like to state here a few examples of interdisciplinary research where all we can do it. I'm not giving the exact project ideas because that's not the objective of this session. We can discuss only the broader areas where we can apply. Of course, here and there I can quote some of the studies which we are currently involved. The telehealth interventions for chronic disease management is one of the area, and the collaboration could be done between the nurses, computer science people, and the public health researchers. Developing and evaluating a telehealth platform to manage chronic diseases can be done. It can be done for a single disease or a multiple disease also, especially now the community health officers are appointed in every sub-center. Ayushman Arogya Mandir, every sub-center is converted into the health and wellness center where the community health officers are appointed who are mainly nurses. So they have the primary contact for the public in rural areas and in other areas. So if we have telehealth interventions, they should be connected so that they can contact any expert for clinical decision making. So this is one area where interdisciplinary research can be done. I think once no in Himachal Pradesh, 140 telemedicine centers were established by a group of hospitals, and they wanted to appoint nurses. Whereas nurses, they were looking for the assessment, screening, and referral skills, which were lacking. So the nurses were equipped with how to assess, how to screen, how to refer, how to interpret the investigations, how to connect the physician with the patient, and what are the expectations of the physician, what are all the data of the patient you want to view through the telehealth. So this kind of training was required. So we have to keep all these in mind when we are preparing the nurses, current generation nurses. We have to prepare them for utilizing these um, kind of technology and helping act as a bridge between the patients and the healthcare team members. And second one is mental health support for adolescents. It's not only for adolescents or any group of people. So we need to collaborate with the psychological experts, social researchers, and this can be done. You know, during COVID time, this was very, very helpful. The helplines were there, and the helplines were attended mainly by the nurses. And mental health registry is there. Mental health professionals registry is there. All the mental health nurses are required to register under the mental health nursing professionals registry so that they will be able to utilize them for such kind of mental health support initiatives. So this is one area where you can think of the collaboration. Next one is reducing hospital acquired infection. Of course, nurses can reduce hospital acquired infection, but it requires the support from everyone else. For example, nurses in the theater may be adhering to all the aseptic techniques, but if the air in the theater is contaminated, there is no modular theater, there are no HEPA filters, and the engineering controls are not maintained in terms of temperature, humidity, and air pressure, then how they will be able to reduce the hospital acquired infection? It is very difficult. So you require a collaborative effort to reduce the hospital acquired infections. Of course, we also require the cooperation of the patient and family members also. So this could be done. So you can see interdisciplinary research of how to reduce HAI in your given institutions. Of course, CDC benchmarks and gives the benchmark of comparing the hospitals across the world. What is the minimum HAI in other hospitals for comparison? So you can keep that as a benchmark and have collaborative efforts to reduce HAI. And palliative care for cancer patients, as I was telling, that we have primary care, secondary care, and tertiary care. And the cancer patients visit all these three facilities and go back to these three facilities back and forth. But if we coordinate between the primary caregivers, secondary caregivers, and tertiary caregivers with palliative care units in a given geographical area, we'll be able to achieve better outcomes. And environmental health and nursing, this is also you have to collaborate with public health researchers, and we can identify the environmental pollutants and how to reduce the exposures. This typically we can say that there are a lot of plastic waste which gets generated in the hospital. So if we work with public health experts and with the people who deal with the recycled products, then the plastic waste created from the hospital can be reduced and it can be converted into a useful project. So the environment will be safe. Otherwise, even I can say that I always say that every nursing initiative can impact all the SDG goals. For example, breastfeeding, you take breastfeeding, initiation of breastfeeding within 1 hour as a nursing initiative. You can support one of the SDG goal, that is life under water. No, saving life underwater. You may be thinking, oh, breastfeeding and saving life underwater, what is the connection? When you breastfeed, they're not going to buy the artificial feeds. So when they're not buying the artificial feeds, then the plastic containers which are used for storing these artificial milk powders are reduced. So you're reducing the plastic waste or the plastic bags. So naturally, the plastic waste, which is disturbing the life on earth and life underwater, can be prevented. So, like this, every small activity which the nurses do, if you explore, we will be contributing to all the SDG goals. So, that also is one of the interdisciplinary approach. So, like this, we can look upon many of the interventions where the interdisciplinary collaboration is required, where it is possible. So, by utilizing the technology and securing the fostering collaborative environment, developing the interdisciplinary teams, securing joint funding, and disseminating findings through interdisciplinary channels, the nurse researchers will be able to definitely contribute to interdisciplinary uh, approach. And of course, we can link it to higher education also. Majority of our MSc nursing projects, we have to look for this kind of interdisciplinary approaches, and so that the higher education also will be improved and the research which is translated into practice will be better. And you may think that part of postgraduate research, how it can be done. Part of postgraduate research also it can be done, because when I was an MSc student, I remember that time baby friendly hospital initiative was becoming uh, formulated and becoming popular those days, and this was in early 1990s. And then I took the topic where after cesarean section to transfer the newborn to the mother side. Those days, 2 days, the babies used to be kept in cesarean after cesarean section in the nursery, and thinking that the mother will have pain, she'll not be able to breastfeed. But whereas in my study, I transferred the newborn to the mother side immediately after cesarean section, and it was a cost-effective study. So I required some if experts from cost effectiveness, because how will you measure the cost? How will you measure the effectiveness? Statisticians were not knowing, and nobody was knowing, because that year WHO's theme was cost effective care, and we were asked to take such projects. Whereas there were very few people who have done cost effective study, or none have done. They were not knowing how to guide us. Then I have to go and take the help of a public health expert who has some exposure to cost effective studies. Then we require the support of obstetrician, because who will be delivering the baby through cesarean. We require the support of neonatologists, because who will be caring for the newborn after birth. And we require the support of the ward nurses, the nurses in the nursery, and the support for a cost effective study. So then, after my study, it was proven to be effective. Then the policy of the hospital changed, and the babies were transferred to the mother side immediately after cesarean section. And until now, the practice is continuing. I think it's going to be almost 30 years now, and the practice is happening. So, such kind of, even at the academic research, it might be your departmental research or institutional research or academic research done by your students, still, this interdisciplinary approach is possible. And all the best for all of you, and publish such studies so that it will remain as a motivation for others to go for interdisciplinary research. So thank you, Chitkara. Everybody's eyes are on TV who will be winning the election. So amidst on this interesting day where the election counting is happening, you have given me such an important topic to speak. Thank you very much.